Hi, everyone. We're so happy that you decided to join us for this really important discussion on parent and caregiver mental health. My name is Stephanie, and I am the founder of Chromosome 22 Central and mother to Maya, age 26, who has a rare chromosome disorder, Emmanuel syndrome. First off, I want to explain why I'm even qualified to be here to talk to you about mental health. My own experiences with mental health issues came before I even had my daughter Maya during the time I was trying to have a family. I experienced recurrent miscarriages, 4 of them over a 2-year period, which left me very depressed. We waited for several years before starting a family as we were young when we married. We planned to have 4 children and it was going to be perfect, but it didn't turn out that way in the beginning. After my 4th miscarriage, I was incredibly distraught and had horrible thoughts. I wasn't a capable wife and I couldn't give my husband the family he wanted, that we both wanted, and I began to tell myself that I was a failure. When we finally did have a child, Maya, I discovered that I was a carrier of a balanced 1122 translocation, and this explained all of the miscarriages. Maya was in the hospital in an ICU with serious breathing and feeding issues for 3 months after she was born. I decided to tie my tubes. I would never have the perfect family, and now I had a child with disabilities so severe the doctors told me she may not see the age of 5. How was I to resolve all of this? I was 24 and I felt like my life was over. I kept looking backwards at how free my life was before having Maya. I felt fear for the present and managing her medical and developmental needs. I felt fear for the future, knowing that she would never be an independent person. I worried about my mental health, my marriage, my friendships, and my strong desire to work. It was an overwhelming feeling for many years, and it was difficult coming to grips with so much uncertainty in a situation that I felt would never ever change. Maya was just not going to get better. Did I have the skills to handle this? I had so many worries and thoughts. And it was not just the immediate diagnosis I had to work through. There were changes as she grew, behavior challenges that complicated everything and brought me to my knees with grief and despair. I wanted today to be about the tools I used to get through all these very difficult, life-altering events and come to a place of peace, not only in my personal life, but professional one as well. I'm here today with my oldest and dearest friend, Joan Charlebois. Joan is a practicing psychotherapist who has her Master of Social Work degree. She has kept me learning and growing for 25 years, and I wanted her with me today. I'm also now a registered social worker and work in the field of mental health, and I have training in cognitive behavioral therapy. So how did I go from a blistering hysterical mess to someone who is able to help others find balance? With a lot of work on myself, a lot of practice, and a lot of help. Thanks, Joan. Say hello to everybody.
Hello, everyone, and welcome. It's so nice to be here. It's my honor and privilege to speak with you all today. A bit about me. I was born and raised in Timmins, and I have a master's degree in social work from the University of Toronto. For the past 21 years, I've owned a private psychotherapy practice counseling solutions here in Timmins. I provide services to adult individuals and couples for help with a variety of issues, including managing chronic stress, anxiety, depression, and yes, burnout. So I've known Stephanie since 1996, right from the humble beginnings of C22C when her daughter Maya was just a year old. And I've seen firsthand all the challenges, hardships, and joys that she and her family have gone through in their journey with Maya to where she is today.
So here you are, and I guess that most people who have joined this webinar are here as caregivers, parents, grandparents, and you may or may not be struggling to cope. Not everyone is going to have the same experience I did, but everyone can benefit from some proactive ways to stay well. There's no magic potion, but there's a few ways that can help. There are going to be days that you struggle more than others, but you can learn to be proactive and resilient as you care for your child and be ready for the days that are going to be hard. I've broken the presentation up into a couple of sections. First, what we face as caregivers, and second, what radical self-care really looks like. So don't give up if you feel like logging off halfway through. You're going to miss all the good stuff. We're going to be covering information about our risks as parents and caregivers, an understanding of trauma, anxiety, depression, caregiver burnout, radical self-care including self-compassion, mindfulness, acceptance, and healthy habits, beating isolation, ways to get help and keep yourself well. So now let's talk about some of the challenges we may face as parents caring for children with exceptionalities, talk about some of the realities, and offer a few strategies that you can try yourself or pass along to someone who may need it. So first, let's take a look at the known risks for families like ours. As parents, we don't always recognize that our role in caring for someone with a disability can be more than a typical parenting experience. We are also caregivers, And we need to acknowledge that so we can access the support we need in order to keep doing what we need to do. It's a given that we eventually learn the tools that we need to care for our children with their learning differences or medical needs. I remember learning how to gavage tube feed Maya in the hospital. Gosh, that still makes me feel weird. But we don't often have someone send us off into the new world with tips to protect ourselves, do we? First off, I'd like to start with some statistics. When I was doing my research for my book, Raising the Goddess of Spring, I found several studies that talk about PTSD, anxiety, depression, acute stress, and illness in caregivers of children who have medical and/or developmental needs. It wasn't easy to find studies specifically on the mental and physical health of caregivers for children with chromosome disorders. Maybe that needs to be my next big project. But there are a lot of studies on parents raising children with various exceptionalities, like medical, developmental, and behavioral needs, which are really commonly seen in our children. We have to start looking at the limits of what we're capable of, which of course is a lot, but we have to be careful not to do the super parent route because it may lead to caregiver burnout. We want to do it all. I certainly tried, and I ended up at the psychiatrist's office. We think we can do it all, but we shouldn't. We need to learn to take care of ourselves and ask for help when we need it. Parenting is hard. Parenting a child with significant healthcare or developmental needs is even harder. Parents in our position are more likely to experience anxiety, depression, stress, insomnia, and fatigue than those who have children with typical needs. Some of the mental health interventions that have been studied to be helpful for parents of children with special challenges include stress management and relaxation techniques, which we're going to talk about, mindfulness and acceptance. Sometimes parents find it difficult to access support where they live. There may be wait lists for in-person support, or you may worry about financial restrictions for costs of therapy, but there are actually a lot of free supports we will talk about. We may need medication for anxiety or depression, but this may be only part of the picture, and there are other things that you can do that are free, and I'll talk about some of these things. For now, let's take a look at a few ways that we're affected by the stress of raising our children and what we face as parents.
So I'd like to talk a little bit about trauma. When we think about trauma, we often think of violent acts, personal attacks, car accidents, natural disasters, or war as sources of trauma, which they are, but there are many more ways in which trauma can manifest and become an issue in our lives. Unresolved trauma can lead to developing symptoms of post-traumatic stress disorder, or PTSD, which develops out of life-threatening fear that affects either us or, in the case of parents with special needs children, a deep-seated fear for their very survival. There are cases where parents may watch their child experience ongoing stays in the intensive care unit, endure multiple risky surgeries, experience life-threatening medical challenges, or even die. So trauma can result from these direct or even indirect experiences. Witnessing your child suffer and struggle on a day-to-day basis is referred to as vicarious, or otherwise known as secondhand trauma, in which we feel traumatized by witnessing the pain and suffering of others, including the fear of loss of life of those we're close to, especially between parents and children. So while symptoms may not meet the current diagnostic criteria for an official diagnosis of PTSD, parents can still undoubtedly experience post-traumatic stress symptoms as well as acute stress disorder symptoms. These symptoms include, but are not limited to, feelings of anxiety, depression, restlessness, sleep disturbances, intrusive thoughts, and more. So this creates an abundance of additional stress on top of an already challenging situation, making it very difficult to cope at times. All the more reason why radical self-care is not only beneficial, but absolutely necessary.
Yeah, and many of us have children with life-threatening issues, heart conditions, severe seizures, organ failure, things that can be incredibly traumatizing to witness. There have been studies done in the not too distant past where, parents whose children experience significant illness and injury, it was found that 63% of parents met the criteria for acute stress disorder, and the majority of studies found that 25% of parents experienced PTSD. While most parents learn to adjust and cope well over time, a significant number of parents will suffer long-term effects that are clinically significant. These are substantial numbers. Help in the early stages to prevent parents who experience acute stress disorder and post-traumatic stress symptoms from going on to experience the more severe and longer lasting challenge, post-traumatic disorder, can really make a difference. So in addition to some of the comments Joan has made, it's also important to know that it's also important to know that as parents become connected with other families as a means of support, we're now exposing ourselves to the traumatic stories that other parents are sharing with us, and they're detailing their own lives as they seek support from us. So the world we've entered has the potential to cause us a great deal of distress. While most people will adapt and cope well, others may need more support. So I want to talk about triggers. For the longest time, I used to get shots of anxiety through my body and feel weak in the knees when the phone would ring. Was it bad news about Maya? Was it me getting the diagnosis from Alberta? Was it the need for serious heart surgery from sick kids? This anxiety even carried through to work for me for a long time. The phone would ring, a shot of fear would instantly fill me, and I had to recognize what it was, and I had to use cognitive behavioral therapy, or CBT, on myself to learn to live with this and work past it. I actually would get physical symptoms. My heart would race, I'd feel shaky just when the phone would ring. And then for a long time after being in the ICU with Maya, I would get physically ill if I smelled a particular type of laundry detergent that reminded me of the blankets from the hospital. Holding newborns made me feel queasy and made my heart pound. Sometimes I find it still does, and it throws me right off. When I had Maya and I held her as an infant in the ICU, sometimes her airway would collapse and she couldn't breathe. Sometimes she'd turn blue and her monitors would sound alarms. It terrified me, and it took me a very long time to get past this fear of a child dying in my arms. For some other parents, it may be the sound of an ambulance siren that triggers a fear response. I know parents with children who have experienced more than one life-threatening event and continue to go through such events with their kids. These parents have shared with me that they do in fact experience trauma. They can actually really feel like they're reliving these events. And I also know some parents who've required, expert mental health, even hospitalization for mental health stemming from such traumas. For those who are experiencing any form of trauma, it's essential to identify it and get support from your family doctor, from mental health professionals, by maintaining healthy behaviors, and by practicing daily relaxation techniques. We're going to be talking about more of these strategies shortly. I also just want to talk about anxiety and depression. Anxiety and depression themselves are not uncommon things to have for anybody. Some level of anxiety on occasion is actually relatively normal, and many people will experience stress to some degree during their life when faced with something new. You start a new job, you take an exam. These are all typical examples of things that can make you feel anxious. These feelings make us pay attention when we're going through something that's intimidating or scary. Anxiety can, however, make you feel significantly unwell and can present as feelings of dread, tension, irritability, or restlessness, sometimes even as anger. You might feel lightheaded, have physical symptoms such as heart palpitations, feel short of breath, or even be completely exhausted. There are many physical and emotional symptoms that you can experience with anxiety. People will also feel appropriately blue or sad when something bad happens. You break up with your partner, you lose your job. These are all very reasonable experiences that can make you feel down. But feelings of anxiety or feeling down all the time, however, can turn into something more serious. If these feelings begin to interfere with your normal functioning, you may be diagnosed with an anxiety disorder or depression. So when you have a child like I do with a serious condition, it's fair to say that you'd be more likely to experience ongoing feelings of anxiety or depression. For myself, I always worried about what was going to happen next with Maya and found myself in a state of constant hypervigilance. That's a word that just means, you're out looking for something and, danger's lurking somewhere. For me, I was thinking, is she going to choke on vomit and die overnight? Is she going to need another surgery? Is the next phone call going to be something bad? Am I going to be able to cope with it? Am I missing something? Should I put her through that next procedure? Can I keep doing this? And then, is she going to die? I constantly filled my head with worry, and I experienced a lot of anxiety, worrying about all those what ifs. I was always reactive and on edge. It was hard to get out of this constant cycle of worry. Anxiety and depression are both the result of ongoing and self-defeating negative thoughts and perceptions about yourself and your situation. There have been studies that have been done on anxiety and depression in parents who have children with intellectual and developmental disabilities, which are very common in children with chromosome disorders. And, there are elevated levels of depression and anxiety as compared to the typical population. Mothers were at a greater risk of anxiety and depression than fathers. That's, just because often we become the main caregivers. Some things that contribute to the risk factors, such as financial status, the severity of the child's disability, behavior challenges, and a parent's own ability to cope with stress. Of course, you can take these findings in studies and get different results in different studies, but you get the picture. We have an increased risk because, well, this can be a tough journey at times. Fearful thoughts turned inward create anxiety, whereas negative thoughts create depression. CBT, which is cognitive behavioral therapy, is something that can actually help you learn to identify your negative thoughts, challenge them with evidence, and replace them with things that are a little more rational or reasonable. And oftentimes when you start changing your thoughts, sometimes those negative feelings can change with them. We also can't spend too much time worrying about the future. Worrying is such a draining activity, and it's also really super unhelpful. We can't change the past, and we can't predict what the future holds. Spending time worrying about things that may or may not happen is super unproductive and can lead to increases in anxiety and depression and make you generally unhappy. We need to save our energy as parents for when something does happen so that we can cope with things better. We can't always stop worries from coming, but we can use techniques like mindfulness to not let them get foothold in our minds and bodies. Imagine that you worry for hours and hours, sometimes days and weeks on end, about something that's never going to happen. Do you feel that that's worth your time and energy? Probably not. What can you do instead? Start planning. What's your worry? If it's something that's actually realistic and likely to happen, make a plan to manage it if it ever does. It's far more productive. The other thing I wanted to mention is about burnout. What exactly is caregiver burnout, and how is it different than feeling depressed or anxious? So burnout can present as feelings of fatigue, listlessness, helplessness, and even a loss of empathy. It's the kind of tired that a good night's sleep is not going to cure. It's not something that other people can see when they look at you. On the surface, they might actually think that you're doing okay, but inside you're just done. I have experienced burnout. It's debilitating and immobilizing. If we add in challenging feelings of adjusting to our child's diagnosis and all that goes along with that, as well as a lack of sleep, which prevents you from coping, you can be at risk for burnout. The Canadian Public Health Association released a study on caregivers that found, unsurprisingly, that they experienced high levels of stress, depression, anxiety, and low levels of well-being. It's even more pronounced in parents caring for their children. You're investing tons of effort and time into research, paperwork, physical care, and thinking and worrying. It's all very taxing, both emotionally and physically. Caregiving for others does not come without unwanted effects on our own health. We sometimes have to give up a lot. Jobs, relationships, social interaction, and even the thought of having to think about taking care of yourself can cause you to feel guilty. All that stress may result in several physical issues. It can impair your immune system, increase your risk of getting colds. You might have more frequent infections, headaches, flare-ups of asthma even, eczema, acid reflux, and irritable bowel syndrome. There have been a lot of large-scale Canadian studies that have confirmed long-term health impacts, chronic conditions, activity limitations, general health, and depression for parents who care for children with health issues. It's especially true for parents who have children with more complex issues. The 2019 study that was done by Toronto's Hospital for Sick Children confirmed that parents who have children who are chronically ill experienced greater anxiety and depression. 35% of parents were reported to have clinical depression and 57% had anxiety. Additionally, mothers who have children with congenital anomalies, like I do, even have a higher risk of cardiovascular disease and mortality over the general population. That's a bit scary. So we have to watch for the signs of stress. Are we starting to feel a loss of energy, have fatigue? Are we starting to feel more isolated? Are we starting to turn to substances or alcohol to cope? What's our digestion like? Are we sleeping? Have we lost interest in things that normally give us, a measure of pleasure? Have our eating habits changed? What about our focus and concentration? Sometimes we can even be edgy, irritable, angry, and feeling trapped. We have to take the amount of stress we experience seriously and understand the importance of self-care. So here's what we're going to start getting into the good stuff now. So radical self-care. It's a well-observed fact that parents will sacrifice their physical and emotional well-being to make sure that their children receive the care they need. If your child happens to have complex needs, this type of parenting is considered intense. I know what you're all thinking. How am I ever going to fit in time to take care of myself? With all the meetings, appointments, day-to-day care, exhaustion from not sleeping, and the multitude of other reasons we have, there's no way you can fit in such a luxury. But you're going to have to try to stay well mentally and physically, because sometimes coffee and a bubble bath are not going to cut it. One of the simple and free things we can do for ourselves is self-compassion. If I asked you if you've had any unkind thoughts about your abilities as a parent trying to navigate this new world, what would you say? Have you been hard on yourself? Have you thought that you should be doing more? Trying harder? Is all that pressure you're putting on yourself causing you more stress? If you answered yes, you might want to give self-compassion a try. Self-compassion, a concept that stems from Buddhist philosophy, involves being kind to yourself in supportive and understanding ways. It can help reduce anxiety and depression. It helps remind you that you don't have to be perfect and lets you accept where you are, doing the best that you can do. I believe that this is so important when you're raising a child with needs that are often outside the scope of typical parenting. How can we possibly know what we need to do? My favorite saying is, I don't know what I don't know. Whenever I feel like I make a mistake or find something out that might have been helpful for my daughter, I let it go. Why are we so hard on ourselves? There's research that suggests that self-compassion can be a positive internal coping mechanism for parents with children with intellectual and developmental disabilities. We can be so self-critical, sometimes isolated, and rarely take time for ourselves. Our minds overrun with negative thoughts and emotions, which just ramp up our stress levels. We have to let go of the lies that we tell ourselves. There's nothing worse and nothing that will bring you down quicker than filling your mind full of negative self-talk. It's going to make you feel like heck and make you feel like you're not worthy of anything good. Stop blaming yourself for your child's condition. You didn't do anything to cause it. You didn't saddle your partner with a lifetime of stress. These are things that I've thought. Of course I can do this. Stop saying that you're not capable. You deserve happiness. You will have a good and positive life, and so will your child. You have so many strengths. Your kid's awesome. Work on a healthy view of yourself and your situation. Hold your head up. And this is the best thing that I always tell people. Whenever you say, I am, make sure what follows those two words is something that's worthy of you. You can Google positive affirmations and use them daily. Stop criticizing yourself. You have got this. Repeat after me. I'm awesome.
I'm awesome.
When you set goals, make sure they're realistic. Set limits for yourself. Learn to say no. Nobody is going to die if you don't contribute to that bake sale at school. Practicing self-compassion can help buffer some of these challenges. When you're hard on yourself, staying awake and overthinking your efforts, ask yourself what advice you would give to someone you loved and cared about who was in your position. Would you be as hard on them as you are to yourself? Of course not. Offer that same love and compassion to yourself. Today, you are enough. The other thing that I wanted to talk about that I've really embraced in the past few years, and especially in my work with the clients that I work with, is mindfulness. So mindfulness sounds a little woo-woo maybe a little difficult, and it can take a while to get into it, but it's really an amazing tool. We spend a lot of time with what are called automatic thoughts. Our head just, we're constantly filling our mind with things that just pop in. We have no control over it. Some of this stuff just shows up and it can make us feel horrible. We're either thinking about the stuff that's happened that we can't change, or we're worrying about things in the future that we can't predict. What we got to do is focus on what's happening now. You'll be able to clear your mind to make better decisions and think more clearly and feel calm. You can take the time to escape these thoughts through little mini mental breaks. You can take 5 minutes out and get back to things later, but doing this is going to pay off for you with a sense of peace and clarity. Buddhism is where I first learned about mindfulness. I happened to take a course when I was in university. While it may have its roots in Buddhist practice, mindfulness has actually become more popular and well studied for its stress-reducing benefits, particularly for parents raising children with disabilities. Mindfulness can help you learn to be more self-aware, reduce stress and anxiety, and help you cope with confusing or unhelpful thoughts. So what exactly is mindfulness? Mindfulness is simply a way for you to learn to practice being present in the moment. It's recognizing how we're feeling, becoming more aware of our thoughts and emotions and feelings without judgment or reaction. It can also be about practicing acceptance. Mindfulness offers a way to escape the things that we're worrying about, if only for a little while. It can be as simple as taking the time each day to practice deep breathing. Mindful practice might look like meditation, prayer, yoga, body scanning. There are many mind-body techniques that can be helpful. Even doing art can be mindful, or journaling. There are many ways to begin gently working yourself towards mindful practices that are simple and free. You can even eat mindfully. For example, pay attention to what you're eating next, the shape, texture, taste, every aspect of the process. Focus only on what you're doing for the entire time you're doing it. Have you ever noticed yourself going through something and then having little memory of it? Your mind was elsewhere while you were in action. The point of doing something as simple as this is to remove yourself, even if just temporarily, from whatever negative chatter is going on in your head and puts you right into the beautiful and calming thing that you're enjoying at the moment. Studies are beginning to show that mindfulness practices are effective at enhancing the psychological well-being of parents of children with disabilities. It can help parents who are feeling overwhelmed by their child's current and future challenges by strengthening your inner resources, building psychological resilience, helping parents with acceptance, and increasing a parent's ability to tolerate uncertainty. When you combine mindfulness with cognitive behavioral therapy, it can help increase attention over distressing thoughts, especially where parents are struggling with change and acceptance. Practicing every day may actually help reduce the physical symptoms of tension and anxiety. There are even some organizations that are teaching parent courses on mindfulness and acceptance, at least in Ontario. One of the places that I'm aware of is Holland Bloorview Kids Rehab Hospital. They had a course in the past couple of years just for helping parents. One of the other things that I like to use is imagery. We can take a few minutes of our day, find a quiet space, and visualize a beautiful memory you had, a good happy time in your life. Wherever you choose to go in your mind, make it calm, safe, peaceful, and happy. Use all of the 5 senses that you have to place yourself there. What can you see, taste, smell, feel, and hear? The one thing that I like to use with my clients, one of the exercises, is called Leaves on a Stream. You can actually look that up on YouTube. You can also try some guided imagery exercises. You can find a ton of stuff on YouTube. Whatever is going to set the tone for your mood to shift, make it positive and happy and daydream. You can also check out mindful.org to get started. There's so much freely available videos, exercises, and practices online that are going to help you find your Zen.
So I'd like to take a minute to talk about acceptance. Stephanie did touch on that. So in my experience as a therapist over the years, I've often come across people resisting acceptance because they believe that if they accept their situation, then it must be okay, which only creates more pain and suffering, when in fact nothing could be further from the truth. Just because you accept a situation doesn't mean you have to like it. What it does mean, however, is that you can learn to make the conscious choice that you are in control of and let go of the resistance and move towards accepting the situation. Acceptance does not mean throwing in the towel and giving up. Rather, as soon as you make the healthy choice to accept, that then frees you up to look at what other conscious choices you can make in regards to managing your situation with your child and safeguarding your mental health at the same time. Acceptance also lets us go of any misplaced guilt we may be carrying as well. We can learn to manage our expectations about ourselves and our situation by making sure that what we expect is grounded in what the situation and the evidence actually shows us. Frustration and stress is created when we hang on to expectations of our children, ourselves, and others that are not met, creating an emotional bind that's very hard to get out of, and it can wear us down to the point of anxiety, depression, and burnout. So acceptance really is the key to managing any and all difficult situations.
Yeah, and I really agree with that. Coming to a level of acceptance about the challenges your child may face is a tough one. We can't change things. We can't fix it for them, and we can't go back. We need to find a new level of normal and acceptance. We have to ask ourselves, what are things that we are actually in control of? We can't prevent the next crisis, but we can certainly plan and prepare for it. That's going to offer us a measure of control. Sometimes the only thing that we control is our reaction to a situation. Is that going to be positive or negative? Make sure it's in line with the values that you hold. Save your energy for things that you can actually influence. Make sure you boost your abilities for things within your control. Oftentimes, our way of seeing our situation can contribute to our emotional distress. We can focus on solving problems, increasing our social connections and supports, and positively reframe our situations. We can learn to manage our emotional responses to things that are outside of our control. If we find it difficult to do some of the self-care things we want to do, we can try even lessening the expectations of our day. We need to slow down and focus. We can't spend our time looking backwards. That place no longer exists. And when we ruminate on things that we can't change, it's going to make us feel worse. All the scary stuff becomes an ongoing narrative in our minds. If we tell ourselves we're a victim and throw our hands up in defeat, we're giving up our power to think that we can actually cope. It's okay to feel overwhelmed and scared. We don't have to pretend everything is all right. Accept your feelings. We may not have the power to change things, but that doesn't mean that we're completely powerless. What are we learning? What kind of skills are we developing? There are some studies that have been looking at the role of acceptance and commitment therapy as an intervention for parents who struggle with coming to terms to their diagnosis. If you're interested, Google it. There's tons of videos and articles online. The more you teach yourself, the stronger and more resilient you will become. So the other thing that I do often with myself, with my clients, is just breathe. Sometimes something as simple as practicing deep breathing actually works. Why? It helps us by slowing down our heart rate, lowering our blood pressure, relaxing our muscles, and helping us exchange carbon dioxide for oxygen. Even Navy SEALs practice this to help them cope with the significant demands they face. It's a good thing to try, especially if you've ever found yourself in a panic attack. I know I have been there. Breathing helps distract us from our negative emotions. Have you ever noticed when you're anxious how rapid and shallow your breathing is? Deep breathing helps counteract this and induces what's called a relaxation response. There are some easy breathing techniques that you can try when you're stressed out. One of the simple ones that I tell people is smell the flowers, breathe in through your nose, and blow out the candles through your mouth. Another really simple one to try is called the square breathing technique. You can write that down and look it up later if you forget what I say, but it's really just finding any square, a laptop, a table, a window, a door, a wall. You can do this while you're sitting at the hospital waiting room if you're feeling very stressed. You inhale slowly through your nose to the count of 4 as you follow up the left side of the square. You hold your breath to the count of 4 across, and then exhale slowly through your mouth to the count of 4 as you go down the right side of the square. And then hold your breath as you move to the left across the square. And you keep repeating this until you feel calm. Oftentimes it can take 5 minutes or longer. It's a simple technique, but one that can really help you feel to calm down when you're feeling anxious or upset. The other thing I wanted to talk about is eating and exercising. You can spend a lot of money trying to treat anxiety and depression with medication or therapy, but try combining these treatments with eating well. There's actually a new field of science called nutritional psychiatry, which is beginning to understand just how much of what we eat contributes to our sense of well-being and reduces the risk of poor mental health. We're so quick to turn to high-fat, sugary foods when we feel stressed. I still do it. My downfall was cake. Lots of cake. Ask Joan. Joan's laughing because I'm talking about cake. So much cake. Every time we went out for dinner, Steph's going to have cake first. While I make fun of that, it's actually, it was definitely a problem. Science is showing a relationship between diet quality and mental health. It's something that we should take seriously and something that we can actually control. Cake may make me feel really good in the moment, but it's definitely not helping my gut bacteria and will ultimately mess with my levels of serotonin. So serotonin is actually produced in your gastrointestinal tract. Is it any wonder that one of the triggers of irritable bowel syndrome is stress? Serotonin is working its butt off to help you sleep and keep you emotionally stable. Your gut and your brain are connected. Try to keep them working well together by making good food choices. And then the other thing is exercise. It's well known to be a mood improver. Many studies describe the benefits of treating depression, anxiety, and stress through regular exercise. And you know this. So because I'm worried about you, I want you to take this message seriously. Exercise directly affects our brains. It produces endorphins. These are chemical messengers in the brain that make us feel really good. It lets us focus on ourselves and often gets us interacting with other people and away from our problems. Some studies report that it's even as good as medication at treating mild to moderate depression and anxiety. So not only does exercise benefit our mental health, but we need to stay strong. The reality for some of us is that we need to keep ourselves in good physical shape if we're going to be able to strong enough to manage our caring for our children physically in the future. My daughter never learned to walk, and I still do quite a lot of lifting. Some children with rare chromosome conditions may never develop independent mobility, and we have to, be prepared to find ourselves in a position where we're doing a lot of physical personal care. So if you're struggling, consider the physical, emotional, and mental health benefits of exercise. It does a mind and body good. The other thing that I wanted to talk about that's really important is fighting isolation. So we know that sometimes it's difficult to get out of the house, especially in the current COVID climate. When I'm recording this, it's probably just sort of in the fourth wave, at least in Canada. I can't say this enough. Building up your social networks is crucial, online or in person. People who understand you is going to be ultimately very important. You need to have people who can offer you a fresh perspective, people who can invalidate your experiences, people who can build you up, keep you there, and be empathetic, but not treat you like a victim. Speaking to other parents who know exactly what you're experiencing is huge. You don't have to go it alone and think you can handle everything. When you share the load, things can just seem a little bit more manageable. It's also important to do things that are completely unrelated to your child, just for you. Is it possible for you to volunteer or work part-time when your partner's home? Reading, arts, music, running down the street, not away. This is really important too. The more you build yourself up, the more energy you're going to have to be a good parent and a strong advocate. When I was at my worst and starting on antidepressants, I was solely at home with Maya. It wasn't until I started to work part-time at a bookstore when Marty was home to watch Maya, ironically where I met Joan, that I started to feel better. And it may seem like this is obvious, but get outside. Get out into the sun and the fresh air. It's such a great healer. I regularly go on nature trails in my community because it instantly calms me and boosts my mood. A walk surrounded by trees, squirrels, the quiet of nature, seeing other people walk their dogs, it's such a mood booster. Physical exercise is known to reduce the effects of depression. Even start with 15 minutes once a week. There's research to back this up. Being outdoors even lowers blood pressure and stress hormone levels. So go with your child or on your own if you can. Find a green space, a lake, a trail, and feel better. And then, if you've gotten to the point where you feel you've tried on your own to feel better and you just can't get there, you can call a counselor. Thank God I have a best friend who's a psychotherapist, and I give her a lot of credit for my current state of mental well-being. Counselors and therapists are specially trained to help you work through difficult feelings that are making you feel stuck. You may be surprised to know how many parents who have children with disabilities have access to professional mental health support services. You can have general supportive counseling, therapy to work through more complicated feelings, or psychiatric services for more chronic and severe mental health issues. Social workers like we are, psychologists and psychiatrists, even primary care physicians, nurses, occupational therapists, members of the clergy, can all be the type of people who offer these types of services. I have needed and used such services. It was one of the reasons that I chose to return to school and study social work so I could help others who were struggling with their mental health. I know the importance of support and the benefits that can come from professional counseling services firsthand. There's no shame in seeking this type of support. And you may wonder why the last thing I talk about is medication. It's not really necessarily the last thing that I meant to be. Medication for those who are struggling with depression and anxiety can be a really useful tool, and it's absolutely nothing to be ashamed of. I've used it. Many of the parents I know have used it, and some continue to use it. If you've gotten past the point of no easy return concerning your mental health, taking medication can help you gain enough perspective to learn more other effective coping strategies. In our support group, some parents have talked about medication. Our conversations are frank. Oh, I've tried this one. I didn't like it. Now I'm on this one. There continues to be a stigma in public, however, surrounding the use of medication to cope. Nobody really wants to talk about it. Happy on the outside, see, right? I'm coping just fine. Life is great. That heart surgery was a breeze. But inside, you may be collapsing. You may not have the necessary coping strategies or support you need to get through this challenging time, and your emotional dam has burst. Whether you consider the use of medication for a short time while you build yourself up and a support system back up, or if you take it on an ongoing basis, either is perfectly okay, and both are relatively common in our support circles. And this is something that I have been doing for the past 26 years as Maya's mom. Keep learning and keep asking. You can find so much online in the way of self-help. YouTube videos, self-help books and websites, printable worksheets and guides are all tools you may wish to use in planning your self-care. You can take control of your mental health and learn to keep yourself well. In Ontario, there's actually a website called Ability CBT, which is a free online CBT-based support. Maybe there's something in an area where you live that can be accessed for free. Parents and caregivers are going to need to be healthy in mind, body, and spirit to be able to care for their children for a long time. And it's going to take effort to ensure that you keep yourself in a good place. The best way to take care of your child is to take care of yourself, as you cannot give what you've run out of. Being radical about your self-care is not selfish, it's necessary. And these are a few apps that I have downloaded and I use in my practice. MindShift is one from Anxiety Canada that's really good. Calm is terrific if you're looking for something to help you with sleeping. Headspace, there's other ones too. Download them and see which one works for you. So we've looked at our risks and understand that we're more likely than typical parents and caregivers to be at risk for mental health challenges such as anxiety and depression. Some of us may have experienced trauma, and we're definitely at risk for caregiver burnout. We have to be radical in attending to self-care. Things that are known to help include self-compassion, mindfulness, acceptance, breathing and relaxation techniques, healthy eating and staying active, avoiding isolation, and seeking support by way of counseling, therapy, or even the use of medication. We also know that there are many ways to do this on our own by continually learning through self-help avenues such as webinars and apps. I've found myself in dark places, and I know that these ways can work. If anyone does feel the need for extra support, I'm always able to talk to anyone by email. You can email me at c22central@gmail.com, and I'm happy to talk to you anytime about this topic.
I'd like to also just add that actually, as a result of COVID, one of the few benefits is that there's so many online and virtual mental health supports available now, many of them free of charge. So please feel free to Google that, and you can reach out and get support right from the comfort of your own home.
That's awesome. And I would just like to give a shout out to Joan for assisting me with this talk, the content of the talk, and most of the content of this came from 2 chapters of my book, Raising the Goddess of Spring. You can find it on Amazon. So thank you very much, Joan, for joining me today.
You're more than welcome.
And I wish you all good mental health. Thank you and take care.